can't tell you how many clients I've given this self-traction or decompression technique to. If they're struggling with sciatica or disc herniations or pain down the leg, this is a great stretch or traction technique that you can do with this Swiss ball to actually improve the space in your back. Let's go over this technique right now. So what you're gonna wanna do is grab a Swiss ball and make sure the Swiss ball is big enough. I'm gonna put a link in the description, but the key here is the size of the Swiss ball. I've been in the inversion tables, I've been in the traction seats or chairs. This technique is really great because you could do it at home and you don't have to go anywhere to get it done, but you've gotta make sure the setup is key. So it's gonna take a couple seconds here to set up. So you're gonna be belly underneath the ball. Check the description if you don't have this Swiss ball. You're going to try to relax over the ball here. So in order to improve that space in your back, you have to relax the muscles. You've got a bajillion muscles sitting around your spine. And yes, this technique does improve space, but you have to move past the muscles before you get around the nerve and the bones. So belly on top of the ball, head down, arms down. Relax everything from your toes to your quads and hamstrings to your glutes, your lower back, and your neck. Relax everything down. Now, what you should feel is your lower back pull here, lower back pull here. So head relaxed, keep your tongue relaxed, keep your teeth relaxed, keep your back relaxed, relax your core, and relax down. Whew. Now, when you're dealing with herniated disc or sciatica, sometimes you have pain down the leg. Here's the rules with this. No pain down the leg with this exercise. So there's usually two situations that happen. Is when you first lie down in this exercise, you have a jolt of pain or jolt of pain somewhere because things are relaxing. If that happens, just relax for a second, see if it goes away. If it doesn't go away and you start to lie here and it's like zoom, 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 radiating down the leg and into anywhere, then you need to relax. It's okay, or you need to stop it. It's okay if you feel anything in your back, but down the leg is what's key. The peripheralization of nerves is important to know. So relax over that ball. And what I mean by peripheralization is that if while you're doing this technique and you start to experience glute pain, calf pain, hamstring pain, and it doesn't go away during the technique, then that's called peripheralization. And that's phenomenon of peripheralization, and the opposite of that is centralization is something that I discuss in my book, Revision Sciatica. And we go over even more detail of how to improve nerve pain and those related conditions. But if you're peripheralizing or pain's going away from your back and down the leg, that's not good. So stop this decompression technique and wait for it to go away. But this decompression technique helps improve space in your back. It literally helps to, I can't say this enough, improve space, like around your nerves that's causing your pain. When you open up that space, you feel better. You relieve pressure off that nerve. And what we know by studies is that these traction techniques do improve millimeters of space. So lay over the ball, relax everything, hang out here for a minute, and improve that pressure and improve how you feel. Relax everything. Now, sometimes you do have to shimmy a little bit forward or back or side to side to really get that relaxation. But a lot of people think they need to either go to a clinic and get traction done or get an inversion table, but it can be as easy as using a Swiss ball and relaxing over that Swiss ball and enjoying how that feels and that decompression. And when you move your spine and you're in that flexion position and you improve that intervertebral space and that disc pressure, you start to feel a little bit better. Now, what's great is you could do this as much as you would like, as long as you don't peripheralize. You can hang out there for a minute. I've had patients only do it once a day. I've had patients do it 4 times a day. It doesn't really matter. You need to find what works for your body. Now, I will tell you, and the research is pretty clear about this, is that when you're doing this decompression technique or traction technique, it does improve the space in your spine. It feels pretty good. You do improve the pressure around the nerves. Now, that pressure improvement will result in improving your discomfort. Oh, there it is. That's where I feel it, right here. Traction over that ball. Hang out here for a minute. And do it. Now, like I said, it does improve space and pressure around the nerve. What's really interesting though is that when you look at the research, the people who combine stretching and strengthening around the decompression techniques do better. So that's why when I was writing my book, I developed the SPARK program, which is SPARK. So S is strengthening, P is the pain relief. This is a pain relieving technique. And R is regaining mobility. And so it's important that you do some strengthening before, or around the traction technique, and you're also regaining mobility. So I have some patients who will be doing like a set of bridges exercises, and they start to feel some back pain or sciatica, and then they get on the ball, and then they give themselves some relief, and then they go into some stretching afterwards. And that stretching could be as simple as sitting your butt back and relaxing down, okay, kind of side to side. And so you're combining strengthening, pain relieving techniques with the traction and mobility. And the beauty of all of this is that you can do that strengthening, pain relief, and regaining mobility. You can do this in your home by using this Swiss ball, gently relaxing over the ball, improving your back pain and leg pain when you have sciatica and herniated disc. And if you're not sure, just take my free quiz. My quiz is in the description. It's going to help you decipher, is my sciatica coming from a disc herniation or some bony structure? It's easy to do. It's a few questions and you'll figure it out. If you want to take it a step further, get my book, follow the 8-week program, and improve your mobility and nerve health, as well as decompressing the spine and strengthening. Those are all great solutions. But to recap here, instead of driving to the clinic and getting in a traction machine or buying some sort of expensive unit, spend the money on a 65 centimeter Swiss ball or exercise ball. Get on your hands and knees, and if you have a hard time getting on your hands and knees, then I can understand why you may be exploring other things. But if you can get there, all of the pressure will be on the ball. So don't worry about your knees. There's not going to be a lot of pressure there. You're going to relax over that ball, head down, shoulders down, round out over it, and then in that moment, as you're rounding out, you're improving the space in your spine. You're improving the space here around your nerves to allow them to relax and breathe. And so if you have any questions about this traction technique or self-traction technique, just ask them. Put them underneath the description of the video. I think it's important to get these questions answered, but if in the ideal world, if you had the moment and you had the time, make sure you work on your strength and mobility. If you're not sure what to do, then pick out the book. It's a simple way for you to have it just laid out for you and in front of you, so you can do it at your own pace. But after you do some sort of traction or distraction, make sure you walk and move and strengthen. It's important to do. If you guys like the video, please just share it with somebody that may find benefit from it, and make sure you get your questions answered by asking them. But use this Swiss ball for what it's worth. Use it when you need it. This traction technique can be done multiple times. I hope you guys enjoy it. Start with a minute, work on it every day, and it should improve over time. So if you guys had a moment just to go through the video, and just let me know what you think. But otherwise, guys, as always, stay healthy, keep moving, and take care of yourself.